I'm worried. Certainly those teens that were out and about were very busy people, and the people that they were helping are not going to be going away.
Right.
It's still going to continue to be an issue.
So what was the role of these teams? How many of there were there on a typical night?
Well, we had 6 teams, 2 that were covering the LRT system, 2 that were doing the downtown mall area, 1 at the public library, the Stanley Milner,
Right.
and then 1 sort of roving and doing events and whatnot. Over the times that we ran, they responded to and reversed over 440 overdoses. That means that someone wasn't breathing when you say you reverse them. But then many, many more who were perhaps, not very cognizant or, a bit stuporous.
Yeah.
Yeah. They had over 58,000 interactions with people. They distributed about 20,000 naloxone kits. And then they did many, many referrals to detox and treatment programs as well.
So what will happen without this program?
Well, first I'll say that we're still hopeful that we will come up with some funding.
How much funding do you need?
Well, it's a big team. It's about over $1 million, $1.5 million a year to keep that running. We keep trying to find whatever sorts of funding that we can to keep it going. And so we haven't let the team go, for example. They're still out there right now.
Yeah.
And we're hoping that we don't ever get to that point.
There's been a lot of discussion. We have people on here all the time talking about this and, politicians and whatnot. You're on the ground. What are the areas you think need to be filled in if we're going to, come to some kind of solution or help the people that need help?
Well, I still think there's lots that we can do. Certainly our teams are very supportive if someone wants to go into a treatment or detox program. Some people aren't there in their lives or they don't need a detox or treatment program. And so having other alternatives and I think really nailing down what is the real issue here. And in our view, what is overwhelming is the poison nature of the drug supply.
That's a tough one though, isn't it?
It's a very tough one. But you know what? I think if we were courageous and thoughtful, we could come up with some solutions.